OC laser spine sport and disc. And here's Harley's professional college volleyball athlete, and he strained his low back, and here we're restoring normal movement patterns through this ATM Back Project rehab machine. So basically Harley has pain with extension and left lateral flexion, so as he's going up to, for instance, spike the ball, because his muscles are not firing correctly, it's causing some strain in there. So this is normalizing that movement pattern. So I'll show you how he does after this. Is that about 10?
Yeah.
Okay, so let's get him off the machine. Okay, let's assess that movement again. Just step off right here and go into extension, lateral flexion. Same, better, worse?
A little better.
Yeah, look at that. He could extend a little. Before, his range of motion is probably half that, and he had pain. Now it's like, you know, the range of motion is almost restored to its full mobility, and the pain was pretty insignificant, wasn't it? Yeah. Now we're going to do forward flexion. So go ahead and flex forward and tell me when it starts getting painful or restricted. Right. See, so you can only go, you want to get the side view? You can only go about, what's this, 30 or so degrees or so, okay? And now we're going to restore that motion. So you can put your back against the pad right here. Alright, so here. Hip here. Okay, now fold your arms back, and you're just going to press your low back into the mat as you kind of do like a crunch, like that. And hold it for 3 seconds, 1, 1,000, 2, 1,000, 3, 1,000. Go back, and again. Continually do this on your own pace. Now, when a lot of people do this, they think the more motion, the better. It's not true. We're not trying to like do like a sit-up or nothing. Just this small motion in itself is enough to make normal movement patterns, because it's really, we're training the muscles, neurology, and how the brain reacts and causes the firing patterns with the muscles to normalize. So we don't need a lot of motion. It's not like the more the better. In fact, probably the less is better, because we don't want to irritate the joints or the muscles. But when just enough movement to train the muscles to fire correctly. Okay? So in this instance, a lot of people get tight hips and over-mobile lumbar muscles. This syndrome is prevalent in athletes. Hips are too tight, the lumbars are too loose, in a sense, unstable, which causes the joints to move too much, causes straining on the muscles which attach there. So what this is doing, we're stabilizing the hips to take the hips out of the movement, and we're in a sense strengthening the lumbars so the movement patterns are put back to its normal condition. What, halfway through, is that about 5?
Feel like 7.
Okay. 8. Let's get 2 more good ones. Push that back, yeah, 1, 1,000, 2, 1,000, 3, 1,000, good back. And 1 more, 1, 1,000, 2, 1,000, 3, 1,000. Okay, that's good. 10. Let's get you out of here and retest that. We always reassess to see if we restored the movement pattern back to normal for now. Okay, let's step forward here. Let's go to the side. Okay, go like that. Go forward. Look how much more flexion he has. It's like 70, 75 degrees. We want 90. Now do it with your arms straight, and how far can you go down? Look at that. He's almost at 85, 90 degrees. That's almost normal. Now, how's the pain going down too?
Not significant.
All right. Yeah. So just that one treatment was enough to restore enough muscle firing patterns to its normal position. A lot of cases we can fix that in just 1 to 6 visits. It take a lot. All right. As long as you're doing this correctly, and you're not doing anything to interfere with the normal firing patterns again. Okay? All right. So thank you for watching, and it's Dr. Phil. We'll see you later, Sports Spine and Disc. All right.